Hello, everyone, and thank you for taking the time to participate in today's professionalism development session. My name is Georgette Villa, and today I will be discussing the important role that effective teams play in improving quality within healthcare organizations. The purpose of this presentation is to explain how teamwork supports quality improvement initiatives, enhance patient safety, and contributes to better organizational performance. We will also be examining the characteristics of high performing teams, the importance of interdisciplinary collaboration strategies for managing conflict and change, and the organizational resources that support long term success. Importance of teams in quality improvement. Quality improvement, or QI, is continuing efforts to improve patient care, increase safety, reduce medical errors, and improve organizational efficiency. Because healthcare is complex, quality improvement cannot be accomplished by one person or one department alone. It requires collaboration among physicians, nurses, medical assistants, administrator therapists, pharmacists, and many other professionals. Interdisciplinary teams bring together different perspectives and expertise to identify problems and analyze data, develop solutions, and evaluate outcomes. Share responsibilities and evidence based decision making. When teams work together effectively, organizations experience fewer medical errors, higher patient satisfaction, improve employee engagement, and better clinical outcomes. Characteristics of high performing healthcare teams. There are several characteristics that distinguish high performing healthcare teams. The first characteristic is effective communication. Team members openly share information, actively listen, and communicate clearly to reduce misunderstanding and improve patient safety. The second one is mutual trust and respect. Every member of the team values the knowledge and the expertise of others regardless of their professionalism role. Respect creates psychological safety where individuals feel comfortable speaking up about concerns or potential patient safety issues. The third characteristic is shared goals and accountability. High performing teams understand the organization mission and work together towards common quality improvement objectives. Team members accept responsibilities for their individual contributions with supporting one another. These characteristics improve patient outcomes by reducing communication errors, increase collaboration, improve care coordination, and promote continuous learning throughout the organization. Team processes and individual roles. Successful quality improvement depend not only on teamwork, but also on clearly defined processes and individual responsibilities. Leadership plays an important role by setting expectations, providing directions, and encouraging collaboration. Individual team members contribute through accountability, communication, and participation in improvement efforts. Effective task delegate ensures responsibilities are assigned to individuals with appropriate knowledge and skills. Data driven decision making and continued education also strengthens quality improvement efforts. For example, consider a clinic implement a new patient flow up process after hospital discharges. When leadership clearly assigns responsibilities to a nurse, medical assistants, and scheduling staff while providing training, follow up appointments increase and hospitals' readmission decreases. On the other hand, if responsibilities are unclear and communication is poor, patient may miss appointments, important information may not be documented, and quality outcomes may decline. Another example involves infection prevention. When nurses and environmental services staff, physician and administrators collaboration using standardized infection control protocol, infection rates decrease. However, if departments fail to communicate or ignore establishes procedures, preventable infections can increase. Cross functionality and interdisciplinary collaboration. Cross functionality teams combine professionalism from different disciplines who contribute unique expertise towards a shared goal. For example, reducing patient wait time may require collaboration among physician, nurses, front office staff, information technology specialists, scheduling personnel, and clinical leadership. Each discipline contributes value knowledge that helps identify workflow problems and develop practical solutions. Despite these advantages, interdisciplinary teams sometimes experience conflict because members have different priority communication styles, or professionalism perspectives. Healthcare leaders can reduce conflict by encouraging open communication, establishing shared goals, clarify roles and expectation, promoting mutual respect, and using collaboration problem solving techniques. Impact of conflict and organizational changes. Conflict and organizational changes are inevitable in healthcare. The technology regulatory requirements, staffing changes, and workflow redesigns often creating uncertainty and resistance. If conflict is ignored, it can reduce morale, increase stress, delay quality improvement initiative, and negatively affect patient care. However, when managed appropriately, conflict can encourage innovate, strengthen communication, and lead to better decision making. Successful teams navigate change by maintaining transparency, involve employees in decision making, providing education and support, and reinforce the organization's shared commitment to patient centered care. Leaders who commit effectively and recognize employee contributions help build trust during periods of change. Resources and support on ongoing quality improvement. Organizations can support continuous quality improvement by investing in resources that motivate employees and improve performance. First, leadership supports is essential. Leadership who provide guidance, remove barriers, and encourage participations create an environment where employees feel valued and engaged. Second, ongoing education and professionalism development allow employees to develop new skills, stay current with evidence based practices, and confidently participate in quality improvement initiatives. Third, effective communication systems include electronic healthcare records, team huddles, dashboards, and quality reporting tools allow employees to share information, monitor performance, and make informed decisions. Finally, employees recognize and reward programs increase motivation and acknowledging outstanding performances and reinforce behaviors that support quality improvement. My conclusion is effective teamwork is one of the most important factors in achieving quality improvement in healthcare organizations. High quality performance, interdisciplinary teams improve communication, strength collaboration, reduce errors, and promote patient centered care. Healthcare leaders play a critical role by supporting collaboration, managing conflict, investing in employee development, and creating culture focused on continuous improvement. By working together towards a goal, healthcare professionalism can deliver safe, higher quality care while improving organizational performances and patient outcomes. Thank you so much for your time and your attention. My references today were Agency of Healthcare Resources and Quality 2024, Institute of Healthcare Improvement 2023, and Marquise B. L. and Houston CJ 2024. Thank you.